Violent crime is putting immense pressure on the Western Cape's public health system, with hospitals treating thousands of gunshot and stab wound victims in just 6 months. Officials are warning that emergency units are overwhelmed, healthcare workers are exhausted, and critical resources are being diverted from other emergencies. Let's talk to Dr. Juanita Arendse from the Western Cape Department of Health and Wellness about these concerning statistics. Good morning, Juanita, and welcome to the program. Thank you for your time. 27,000 violent trauma cases in just 6 months. I mean, it sounds staggering. Of course, as a journalist, and we're a station that carries the news of those various shooting incidents and acts of violence, it's understandable. But from an operational point of view, what does this level of violence actually look like inside emergency centres in the Western Cape?
Thank you so much for having us this morning. So first of all, unfortunately, that 27,000 was in 1 month and not 6 months. The recorded data is from the middle of December to the middle of January. And unfortunately, this places immense pressure on our staff, and we have no choice but to sort of latch onto various partners like local municipalities and partner organizations, EMS, etc., to be able to cope with this. But in our facilities, we are finding that the space constraints is a huge challenge. Our staff ratios, which are under more normal circumstances adequate, is constrained and really stretched. And obviously that has a huge impact on waiting times. Our facilities with the highest volumes, and where you'll probably see patients even having to be cared for in really close spaces, is at Mitchell's Plain, Paul, George, a regional hospital, as well as Helderberg and Westvliet. And our specialist trauma centres at Grootskeur and Tygerberg Hospital also under tremendous pressure. I'm not exempting the fact that even our primary healthcare facilities that are 24-hour facilities are also under tremendous pressure, have been and still are under tremendous pressure over this period.
I mean, 27,000 cases over 6 months already sounds just incredible. When you say it's over 1 month, I mean, that is exponential, just the impact it would have. And you're already sharing with us how it's affecting things like waiting times. What's the rate of people, Dr. Juanita Arendse, waiting and not receiving the care and dying, waiting to be treated?
So we, to be quite honest with you, the waiting times are long, but because we have a triage system in place, we are triaging the clients throughout. So our position is not to send any patients away. Our position is to triage everybody, to determine the triage coding, and then basically have them seen in sequence of their triage. So, for example, a client that is green can wait a little bit longer than a client that is orange, and obviously a client that is a triage red needs to be seen immediately. So the waiting times are long, but we re-triage our patients to ensure that the patient doesn't decompensate while waiting. And should the patient decompensate while waiting, we can respond fairly quickly to that. So it is pressure, it is long waiting times, but the teams are doing the best they can in order to hold that together.
So again, just to pick up on what you're saying, when emergency units are overwhelmed, and we understand that a large number of these cases would be from gunshot wounds, from stabbing injuries, other patients then, as you say, who could wait, certainly also have their own healthcare conditions that would be compromised, or their healthcare needs that would be compromised. How serious would you estimate these knock-on effects of the high volume of really urgent patients is having in places like the ER?
So interestingly, we had 93,000, close to 94,000 non-trauma cases on top of that 20-odd thousand that we've had that were trauma cases. And these are mostly chronic condition patients, so which is a large proportion of those that required admissions as well, and further contributing to long waiting times. So the knock-on effect, I think, either way, because even with blunt trauma, falls, we've had many sports injuries as well, gunshot wounds, all of them basically it's triaged within the same system. So inevitably, it does have a knock-on effect on our non-trauma cases to wait longer than usual. But either way, the waiting times is the biggest challenge that we have. And essentially, our public sector services see the majority of these cases because we don't have that people that don't have access to private healthcare. So this knock-on effect just keeps on coming. I must say one thing, and I suppose that is that from a clinical perspective, we do ensure that we have an array of our teams available during the festive season. We are essential services, so we don't take off during that period. Everybody's on duty that needs to be there. We have access to specialized care, subspecialist care as well during this period. So, and across the platform, what we also do is we ensure that we shift the clients and we move through our EMS services, emergency medical services. We move the clients around knowing exactly where the pressures are the most and where they can still cope if any clients are quite critical. So we have that mechanism in place as well to try and reduce the waiting times.
Sure, and again, just going back with that appreciation for the numbers, you know, we're talking about thousands and thousands of people, and that places a strain on the existing healthcare workers, all the way from, you know, the porters, to the nurses, to the doctors themselves. The healthcare workers are described as being stretched to breaking point. Talk to us about their experiences inside this high demand and these high-risk injuries.
So, you know, they are stretched. The demand is high. And then along with that, often because of alcohol-related incidences, which does contribute quite a significant proportion to trauma cases, also comes sometimes abuse, language that gets used with our staff, which further adds to to what they're dealing with already. So I think there's the circumstances are, it needs to be acknowledged that it is has a significant play on emotional well-being of our staff as well. It does also mean that we need to be available, and we have been with the employee health and wellness to help to manage that, and as well as our managers managing by walking about and being visible on the cold face also sort of helps to manage those circumstances. But essentially, you know, dealing with trauma, dealing with this increased loads, dealing with the fact that we also have a lot of brain drain with a lot of our professionals leaving to work in other areas, does put significant pressure on the services. And that, coupled with staff that are often at times also spoken to maybe in a way that is not welcomed. Because of long waiting times as well, exacerbating that, and people expecting to be seen quicker than they are, does add to what our staff needs to be dealing with in this time. So it is a very difficult time, but we are so grateful to our staff for their resilience. We are so grateful for the fact that they are trying to hold things together during this period, and we are also very grateful to our partners that have come alongside our staff in various shapes and sizes, even volunteers. To assist during this time. It's invaluable.
And we salute them as well, Juanita. They're taking care of our children, they're taking care of our uncles and aunts, the elderly in the community, and those who are vulnerable to the types of violence that present themselves where you are. But it is abnormal, right? And it is unsustainable. What is the most urgent thing that will make a difference today? What is the most urgent thing that should be done to change your experience there?
So, you know, I suppose our community is working with us, accessing care at the primary healthcare space timeously, so that, especially our chronic patients, so that they don't decompensate to the point where they require access to emergency services. So accessing the primary healthcare services timeously would be a great help. I suppose drinking and driving remains another challenge. And I suppose that we are focusing on working with the department, the traffic services, etc., to inform them of what we are finding, so that informs how they respond to it. So I think that would be helpful. And I think the big thing is really just violence prevention in general, and efforts with regards to violence prevention. And we do find that even with our very, very young teenagers, understanding alcohol-related harms, understanding substance-related harms, helps to go a long way. But we do need our communities to come alongside us to know how to access appropriate care at the appropriate level, and also to help us with what we deal with in our communities. I suppose another point is our emergency medical services going out into communities, and our vehicles getting stoned. We need our communities to help with that, so that our teams can be more responsive. because that's another challenge that we face on a daily basis and not just during the festive season.
It's just another reminder, the great sacrifice that is made by yourselves and the teams who work in the public healthcare system. Thank you very much for talking to us, Dr. Juanita Arendse, reminding us of the picture of demand, the strain that you are under where you are, but also being able to rise to the occasion, so to speak, for what's needed. But again, by no means normal and sustainable. From the Western Cape Department of Health and Wellness, talking there about alarming statistics relating to what's happening in trauma centres in the Western Cape.